All right, Bob, we wanted to do a follow on to a previous episode, number 197, where we talked about pro resolving mediators, also known as specialized pro resolving mediators. It sounds like a mouthful. And so, for the listeners, if you are unaware of what words I just said and you want some background, and we'll probably mention this a couple times, definitely want to check out our episode 197 to get a little bit more of the baseline information about what these compounds are. Although we'll talk a little bit on this, Bob, but we wanted to do this part two to address the supplementation piece, to explore the practical side and what people can keep their eyes and ears on if they're hearing this term or seeing it in their feeds, or perhaps a practitioner is recommending them just to be more informed. So, Bob, do you want to give maybe a little bit of background, just kind of set the stage?
Yeah. So to your point, Dee, listeners reference episode number 197 because we do more of a deep dive into PRMs. When I hear PRMs and SPMs, for some reason I just think of cycling because RPMs and all this stuff. Anywho, no, we're not talking about that. But these are basically compounds that are made from omega-3 fats, right? So, and you'll learn that in the episode 197. But what we're talking about here is, omega-3 fats are anti-inflammatory fats. What we're talking about here with the PRM supplements is these wonderful things that help kind of resolve inflammation. Like, it's kind of like a cleanup crew, if you will. Yeah. And a lot of talk into PRMs right now in the whole chronic low-grade inflammation, which is also called inflammaging, right? You may have heard that term before. There's a lot of chatter in the longevity circles right now. So obviously inflammation and inflammaging, as we obviously get this chronic level of inflammation as we age, obviously not great, right? Because it's linked to various aging processes, disease states, you name it, from obesity to heart disease to neurodegeneration. So, hopefully we got your attention now, and that's why we're talking about these PRM supplements. Now, of course, we should probably say this, Dee, whenever taking a supplement, like just because we're talking about this doesn't mean you need to take it, right? I think what everyone needs to do first is meet with your health professional, sport dietitian, registered dietitian, whoever provides you the nutrition care. Talk to them about not only this supplement, but I would say even, Dee, before that, do some comprehensive blood work analysis, get some inflammation markers, maybe some genomic testing, right? Let's have you understand your body a little better, because both Dina and I just do not believe in popping a pill to pop a pill, right? There has to be a focus and there has to be a reason. Personally, I do take PRMs, Dee. I take high dose fish oil or omega-3 fats, and I do take PRMs, and that is because of medical health history, genetics, blood work, right? So I've got some cards stacked against me, so to speak, which a lot of listeners have heard before from previous episodes. So for me, it makes total sense, right? But for everyone, I think we need to stand back and say, yeah, these PRMs can work, but you have to understand your situation and your biology first, right, Dee?
Yes, absolutely, Bob. And I think just some things that might pop into people's minds, even though we've touched on this before, when we talk about inflammation and nutrition, is, well, Bob, can't I just eat blueberries and get my salmon in a couple times a week and I'm good? And really, that is fantastic, but it is kind of I don't want to say minuscule, but it's important, and that's awesome if you're doing that. But there's so much more potency, and that word cleanup that you used, there's different things going on, I'll just say generally, with inflammation. And so omega-3s from salmon, let's say, has certain mechanisms, but these PRMs work in a different manner. Quite complex, actually. I think there's still quite a bit of research being done and emerging, especially in human research. So that's important to know, like, it's more than blueberries and salmon, even though that's a great starting point.
Absolutely, Dean. I totally agree. And let's not forget about one of my favorites, dark cocoa or dark chocolate. So let's put that in there also, because I love having conversations about salmon, blueberries, and dark cocoa. Maybe not all consumed together, but definitely in the conversations because of the anti-inflammatories, antioxidants, obviously. But yeah, there's so many, I mean, to your point with fish oil versus PRM supplements, right? they are different. It's not, because I actually hear a lot of people saying, well, I don't need to take a PRM supplement because I'm already taking fish oil. Well, they do different things in the body, right? So like the fish oil is providing us that EPA and DHA. PRMs are actually providing us these metabolites that will actually resolve inflammation, right? So there's, fish oil is needed at higher doses, PRMs are needed at lower doses. So there is a reason for both. If you determine that PRM supplementation is a necessary thing or a good thing for you, then there are differences and nuances to taking both fish oil and PRMs, or one of the other, obviously.
You mentioned earlier some of the types of people or things going on with people where these may come into the picture, but I just wonder if we could expand on that. I mean, we almost could say everyone on the planet.
It's hard not to, but because and I've shared my bias on previous episodes that I do believe that, inflammation and chronic inflammation, call it inflammaging if you want, is really the precursor to so many disease states these days. And I will hold steadfast to that point and my belief there. So yeah, you could probably say just about everyone underneath the sun should probably be thinking about these. However, if we're going to nail these down to specific subpopulations, obviously from a cardiovascular functioning standpoint, if there are, blood lipid disturbances, let's call it, and not just that, oh, my doctor says I have high cholesterol, like really getting into the comprehensive blood work, the NMR, the particle size testing, that's where we really look at this kind of stuff. Fasting insulin. Obviously, we're also looking at a host of other inflammatory markers, and that's what I'm talking about. Like if you, the listener, is having some blood work, biomarker testing done, and your inflammatory markers do show pretty high, and maybe you do have family history, maybe your blood lipids are a little bit imbalanced, there could be a very good case for taking PRMs, even in addition to fish oil or omega-3 supplements.
Also, if you've been diagnosed with an itis, some sort of inflammatory, like actual diagnosis to arthritis, osteoarthritis, rheumatoid those sets of conditions, this could be helpful. I think of also some of the other autoimmune conditions like Hashimoto's or PCOS, some of those things that might, like that underlying inflammatory type state. In terms of supplements, Bob, what do people need to keep their eyes on in terms of ingredients or, safety concerns?
Yeah, let me just push pause really quick on that because I want to do one more subtopic population, and that is high performing athletes, right? And I could probably also say high performing, kind of people in general, but from an athletic standpoint, I actually have a lot of elite professional athletes taking PRMs because of that higher level of inflammatory response that they are seeing in their body from day in and day out, very high intensity or very high volume training loads. So I just wanted to kind of feed that one in. Now, to your point of the PRM supplements. So remember back to episode 197. And again, listeners, if you haven't listened to it, take a quick listen to that or watch it on our YouTube channel, which we always forget to mention. But yes, we are on YouTube. Okay. That said, so the 3 PRMs that we're talking about are called resolvins, protectins, and muresins, right? These are not what the PRM supplements are, right? Because these active not ingredients, what do we call these things? The mediators, I guess you could call them, right?
Yes.
They're
molecules.
Molecules, yeah. They're unstable, right? So they're not stable enough to put in a supplement. So instead, what you're going to find in these PRM supplements are precursors. So these are usually concentrated fractions of EPA and DHA that the body can actually convert into PRMs. Not to get too deep in this, but you can pick up like on the one that I take, it actually has all of these ingredients, but these are the ingredients that are in normal PRM supplements. They're called 17 HDHA, 18 HEPE, 14 HDHA, and then fractionated marine lipids. That's kind of the, Charlie Brown, blah, 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 blah. All you need to make sure is that obviously, you're working with a qualified professional who knows how to choose high concentrated, high quality, tested supplements. So you make sure you're getting these ingredients. But most of the PRM supplements that I've seen on the market, because I have done a little bit of research on them, obviously, and when I was beginning to take them, they will have at least usually all of these, if not the majority of these that I just listed, because these are like the building blocks that your body uses to actually create PRMs in your body, right? Those resolvins, protectins, and myricins.
And usually in soft gel form, right, Bob? Kind of like an omega-3
Yeah,
soft gel is similar.
yeah, it's definitely it's soft gel. I mean, you can still chew it and break it if you wanted to. Like I
Mhm.
do that. I just kind of test it. I think like the omega-3 capsules are a little softer than the PRMs, but yeah, it's actually smaller than omega-3 because again, remember what I was saying earlier, we don't need large doses of
Yeah.
PRMs like we do fish oil or omega-3s. So yeah, it's actually pretty easy. It floats down the throat really easily too because it's just a gel capsule.
The dosing,
Mm,
people might be wondering, well, okay, I'm curious, and how much of this would I need to take? And is this a forever thing, or do I
yeah.
just take it after a hard workout or a race, or
Yeah,
what's the
it's a good
story
question.
there?
I think, obviously everyone is different, right? We know the differences and we know the different reasons of taking supplements, not only PRMs, but what I've been reading and research that this is a long-term thing, right? This is a like if you're showing some challenges from a health perspective, inflammatory perspective, that we're using this long term. It's not just I'll take this for a month or two, right? Because inflammation is inflammation, right? Especially as we're aging, if we're not taking care of ourselves properly, we're seeing an increase in inflammation in our body. So PRMs, in my mind, based on the science that I've read, should be taken long term, absolutely. Now the dosing is tricky though, because I would say, I mean, in research, what it shows is anywhere between 1,000 and 2,000 milligrams a day, right? However, I will periodize that for each individual based on blood work, genetics, like all the testing that we'll have done first. I'll periodize that. And in addition to seeing how they eat, if they do any type of EPA, DHA rich foods, salmon, and like you mentioned. So I feel like even though research has given us that 1,000 to 2,000 milligrams a day, there's a little swing. Like I'll actually go lower sometimes also for some individuals.
With these supplements, at least the few that I tend to recommend has EPA, DHA in it. So it's like a
Mm-hmm.
combination
Yep.
of the PRM, those precursors, and there's usually some other fish, oil or
Right.
the DHA EPA component. So that made me think when we were starting to talk a little bit about safety is if you're allergic to fish, you may not be able to. I mean, you just need to pay
Yeah.
attention and see
Yeah, definitely.
what
Definitely.
product you're taking. Yeah.
Yeah, I think that probably applies to the omega-3s, like the fish oils, right? So if
Across
you're
the board.
yeah, for
Yeah.
sure. I mean, if you're allergic to fish or marine oils, like don't take these, right? It's not going to turn out too well.
Right.
But the benefit aside from that, the minimal side effects. Like I've never heard of any side effects or read of any side effects. And it's not, how fish oil, like sometimes if we do high dose fish oil, we kind of worry about the blood thinning effects of that.
Mhm.
So PRMs, we don't have to worry about that. I mean, in addition to not having to take as much, that is not one concern with taking PRM. So there's another positive for sure.
Time of day. Is this
Yeah,
something sensitive
it,
to when you
I
take it?
I think, what's usually recommended is like morning and evening if you can. However, I also believe that depends on your dosage, right? So if you're taking depending on the brand, of course, if you're taking one PRM capsule versus two, obviously you can I would say take one in the morning with food, better absorption, and call it good. But if you are taking more than one capsule, yes, you might want to split that into a split dose in the day just for better availability, bioavailability, and absorption.
Is there anything else you wanted to mention, Bob, about the supplement form?
I will just share my N of one. Like I've been taking PRMs along with a pretty high dose of fish oil, and I can't say anything yet about that because I don't have blood work yet. But I've been taking these for it's been about 3 months, maybe 4 months. And as we're recording this is the end of November 20 or middle November 2025. I will get my next blood work done in the first quarter of 2026. So I will be able to kind of put this to the test, if you will. Obviously, it's not the only thing I'm looking at, but I did just want to mention that from a feeling perspective, I feel no different, right? Nothing at all.
Yeah.
I think proof is in the numbers. So that's another reason why we both always recommend comprehensive biomarker testing to look at. Like, and I do this all the time, not only with myself, but other clients I work with is, let's do this for a 6-month bout and then retest your blood or whatever marker you're looking at. And then to see if there are changes, because listen, we don't want to spend money if it's not going to work, right? So
Yeah.
the only really way to do that is to test instead of guessing and throwing away your money potentially.
Here, here.
Here. Yeah.
Love
I
it,
mean, I know
Bob.
with myself that when I take higher dose of, fish oil, I know that does radically change my omega-3 index, which means it improves it. Now I'm just kind of putting to the test, like how do the PRMs affect my inflammatory markers, right? So that's kind of what the
Yeah.
questions I have in my brain. And that's why I'm doing this N of 1 test with the PRMs also.
Well, listeners, we're here to help you out. So if you have further questions, want to know more, we encourage you to join our free Patreon community, which you can download the Patreon app on your phone and look for ISN Podcast. Plop a question over in our community. You can also direct message us. That is a fantastic way, especially with things like this that might be new to you. We'd love to hear what your questions are. And if you're taking a PRM type of supplement or SPM, let us know how it's working for you and what you're noticing in terms of your blood work or other things that you're monitoring.
And Dina, I just want to mention really quick, because we do have different membership levels. Like we have free, and then we have 2 that are paid, which is literally a couple dollars a month. That kind of helps us, kind of keep the podcast going, because we are an unsponsored podcast. We don't accept money from anyone. What I was going to say is, in our gold membership, our top one, I'm going to share my top PRM supplements that I prefer and that I've taken, just so our gold members can kind of be like, hey, if I'm thinking about testing these waters, at least I can direct you to better ones, higher quality, because I've done the research already for you. So I'll put that in our gold membership group.
Great. Well, with that, Bob, we will sign off for today. Thank you, everyone, for listening, and catch us next week for another new episode.